Welcome back to Body Spirit Hub. I am so thrilled you're here today. Look, let's treat today's explainer like a private one-on-one clinical consultation, okay? Pulling right from our medical sources, we're going to step into the shoes of a holistic doctor to tackle something huge, natural, root cause solutions for hair loss. We are completely stepping away from those quick chemical fixes and instead, we're looking deeply at how homeopathy can literally heal your body from the inside out.
Let's start with the moment we have probably all experienced. You know the one, you're in the shower, you run your hands through your hair, and you look down at the drain, and yep, there it is, just that sudden knot of panic in your stomach. Maybe you're finding excess hair on your pillow, or your comb is pulling out way more strands than usual. It's a shock, isn't it? Our clinical sources highlight that doctors hear this exact fear every single day. Hair loss is deeply personal. It's not just a physical symptom, it carries a massive psychological impact. But hey, before we panic, we need to answer one absolutely crucial question. Is what you're seeing just part of the natural shedding process, or are we actually dealing with active thinning?
Okay, let's dive into this. Here is our roadmap for today. First, the reality of hair loss. Second, uncovering the root causes. Third, the homeopathic healing approach. Fourth, top remedies for regrowth. And finally, holistic habits for recovery. Let's get to it.
Section 1. The reality of hair loss. As you'll see, it's not just cosmetic. Before we even name it, I really want to validate exactly what you might be feeling right now. See, conventional medicine sometimes just brushes hair fall aside because, well, it's not life-threatening. But man, it is an absolute blow to your self-image. Taking it seriously is step one to healing. Now, to treat something properly, we have to name it accurately. The medical term here is alopecia. Technically, it refers to hair loss in any naturally hairy part of the body, but it's widely come to be known specifically as thinning, baldness, and excessive hair fall on the scalp. Establishing this medical baseline is super important so we can demystify what's actually happening to your body. Now take a look at that number, 50 to 100. That is the number of hair strands the average person loses every single day as a completely normal part of the hair growth cycle. So if you're just seeing a few strands in your brush, take a deep breath, you're okay. It's when your shedding consistently goes way beyond this 50 to 100 range that your body is waving a red flag, right? It's signaling an underlying issue that we definitely need to address. To identify what kind of hair fall you might be experiencing, let's break down the categories just like a doctor would. First up, alopecia areata. This is an autoimmune condition where your body mistakenly attacks its own hair follicles, which causes these tiny, well-defined bald patches. Next is androgenetic alopecia. For guys, this usually looks like a receding hairline, and for women, it often appears as thinning across the scalp, mostly driven by genetics and hormones. Then we have telogen effluvium. If you've recently had a severe illness like dengue, gone through childbirth, or suffered a massive emotional upheaval, this is the excessive shedding that follows. Finally, traction alopecia. This is physical damage, basically permanent loss from pulling the hair way too tightly over a long period. Identifying your specific type is the very first diagnostic step we take.
Moving on to Section 2, uncovering the root causes. Let's look at those internal triggers.
Now that we've mapped out the visible symptoms, we've got to understand the internal mechanics. Why is this actually happening? Well, your hair is always in a cycle. Think of it as a delicate balance between anagen, which is the active growth phase, and telogen, the resting phase right before the hair naturally falls out. But as we age, or as our internal systems get thrown totally off balance, this cycle gets disrupted. The anagen growth period actually becomes shorter, while the telogen resting stage increases. Basically, this means you are losing hair faster than your body is programmed to replace it.
So what actually disrupts that cycle? It really comes down to a few primary internal triggers. Genetics play a major role for sure, but they aren't a definitive life sentence if we intervene early. Hormonal imbalances like excess DHT, menopause, or PCOS are massive culprits here. Severe stress, that literally shocks your follicles straight into the resting phase. Then there's nutrition. Your hair shaft is built entirely of protein, so a lack of proper protein, biotin, or iron in your diet is fundamentally starving your hair growth. And finally, autoimmune reactions, where your body's defenses just get confused and attack the wrong things. Section 3. The homeopathic healing approach. This is all about healing from within. Understanding those complex triggers perfectly sets the stage for how we treat them. And this beautifully illustrates the difference in medical philosophies. Conventional allopathic medicine often uses chemical-based treatments that focus strictly on the surface symptoms. Or, like I mentioned earlier, it sometimes dismisses the issue entirely just because it isn't life-threatening. Homeopathy, on the other hand, it treats you as an entirely unique individual. It targets the specific imbalance, the root cause, whether that's stress, hormones, or immunity, and heals you from within naturally, without the harsh side effects. It's a holistic approach really meant to ensure the problem doesn't just come back later.
All right, Section 4, Top Remedies for Regrowth. Let's look at some customized solutions.
This brings us to the actionable directory of homeopathic medicines for regrowth. First up is a true hero ingredient, Thuja occidentalis. Now, in homeopathy, treatments have to be personalized to your exact symptoms. Thuja is specifically prescribed if your hair thinning is accompanied by a very oily scalp and severe dandruff issues. It works wonderfully to fortify the roots and really clear up that specific scalp environment so new hair can actually thrive. Next is Lycopodium clavidum. And what's fascinating about Lycopodium is that it's made from the distilled spores of evergreen plants. Homeopaths specifically look to this remedy for both men and women who are fighting genetics. We're talking premature balding, hereditary thinning, and patchy hair loss. It acts directly to strengthen those weakening follicles. It's a really powerful tool. Now, if your hair fall is tied to hormones or deep emotional stress, our clinical sources point directly to Natrum muriaticum and Sepia officinalis. Actually, fun fact, Natrum muriaticum is derived from common salt, but it's unlocked through homeopathic potentization. Together with Sepia, these two are absolute game changers for female pattern hair loss, especially when dealing with the crazy hormonal roller coasters of PCOS, menopause, or postpartum recovery. They step in to restore that internal balance and stop the shedding.
Finally, in our remedy toolkit, we have mother tinctures. These are basically potent liquid extracts. Jaborandi is widely considered a premier remedy to stimulate follicles and even prevent premature graying. Arnica montana, on the other hand, works by dramatically improving the blood supply right at the scalp level. What's really great about these tinctures is their versatility. You can take them orally, or you can apply them directly as a topical scalp tonic to nourish those roots from the inside in.
Which brings us to Section 5, Holistic Habits for Recovery, how to support your healing.
Look, medicine alone isn't the whole picture here. Natural medicine works best synergistically. So the crucial point is this: without these actionable, foundational lifestyle steps, the medicines just won't be fully effective. Step 1 is diet. You have got to eat a diet high in protein, iron, and zinc. Think eggs, spinach, nuts, and fresh greens. Step 2, you have to actively manage your stress, maybe through yoga, meditation, or honestly, even just taking a daily walk. Step 3 is completely non-negotiable, 7 to 8 hours of sleep. This is when your body undergoes essential cellular repair. And step 4, be gentle. Skip the harsh chemical shampoos, avoid those really tight hairstyles, and gently massage your scalp to boost that blood flow we just talked about.
Clinical experts always reassure us on this point. Homeopathic recovery takes patience. Healing from within simply isn't an overnight fix. But usually, right around the 3-month mark, you'll start to see these gradual signs of internal healing. First, you'll notice reduced shedding, which means your roots are stronger and follicle health is improving. Then, you'll spot new baby hairs. That's the proof that dormant follicles have been reactivated. And overall, you'll notice an improved texture, where your hair just feels thicker, shinier, and way less brittle.
And that brings us to the end of today's explainer. I want to leave you with this final provocative thought. Are you ready to stop just treating the surface symptoms and start truly healing your roots? Remember, your body is incredibly smart, and when it's given the right natural tools and environment, it knows exactly how to heal itself. Thank you so much for joining me today at Body Spirit Hub for this consultation. Stay healthy, stay curious, and I'll see you in the next one.